Good morning.
Yes.
Good morning, everyone. Johnson, are we ready?
Yes, sir, we are ready.
Fine. Professor Usha, you are most welcome. I hope
Thank you,
you are
sir.
ready. I hope
Yes,
you are
sir.
ready for this session. All right. And very happy to welcome you on behalf of myself and to Lourdes College of Nursing. And,
Thank you, sir.
Wish you all the best for the session.
Thank you.
Okay. And
Thank you, sir.
dear participants, the number is bit less. I am sure that the people might be started joining. And
Okay,
have a wonderful session. Miss Surya, you please start. Okay. You may start now. Yeah. Surya and Usha, please
Yes,
mute your mic until your session gets started. Okay, please. Thank you. And so, Ms. Surya, you can please start.
Good morning, one and all. A warm welcome to all of our fourth day state webinar series Growth and Development, a progressive advancement of little lives, organized by Lourdes College of Nursing, Thaliparamba, Kannur, in association with SNA North Zone. It's my pleasure to welcome our principal, Professor Senthil Kumar T, our well-acclaimed speaker, Professor Usha V, Vice Principal and Advisor North Zone SNA, Mr. Johnson LK, invited delegates, my dear colleagues and students. It's great joy in welcoming all delegates attending webinar series through Zoom and YouTube live stream. Let us start with the fourth day session on growth and development of schooler. Learning about growth and development of children help us to understand and make difference in children who are coming to us. As children develop physiologically and emotionally, it is useful to define certain age-based groups. School-age child development is a range from 6 to 12 years of age. During this time period, observable difference in height, weight, and build of children may be prominent. The language skills of children continue to grow and behavior changes occur as they try to find their place among their peers. Today also, we have an eminent personality and child health specialist as a resource person. With immense pleasure, let me introduce our resource person, Professor Usha V, who will speak about growth and development in schooler. She is currently working as a head of the Department of Child Health Nursing in Kannur Medical College, Anjirakandi. Professor Usha completed her undergraduation from RBS College of Nursing, Coimbatore, and post-graduation in Child Health Nursing from Sacred Heart Nursing College under MGR Medical University. She has 17 years of professional experience in nursing. Presently, Madam is an examiner for undergraduate and postgraduate student under Kerala University of Health Sciences, as well as Rajiv Gandhi University of Health Sciences, Karnataka. With great pride and honor, let me invite Dr. Professor Ushavi to take over the session. Over to you, madam.
Thank you, Surya. A very warm good morning to all. First of all, I congratulate the management of Luth College of Nursing, principal, faculty for arranging this a wonderful webinar series, which is actually needed for pediatric students. I congratulate you all once again, and I thank Professor Sendil Kumar sir for providing this opportunity as a resource person for today's topic. Thank you, sir. And I am also thank my principal, Dr. S. Manjula, for providing this opportunity. Hope you all are eagerly waiting for starting the session. So we move on to the session. So today we are going to talk about growth and development of schooler. When you think about schooler, okay, what do you think schooler? The name itself, you can say the children are about to going school. The very first time out of the family, they are moving to a place in which they are going to learn new things. They are going to explore the world with their thoughts and ideas. Okay, that's what we are going to see in all aspects of development in school age children. So school age or schooler, this period extends from 6 to 12 years of age, and also
Excuse
it has,
madam?
yes sir.
Madam,
Sir, am I audible?
Yes, audible, ma'am. The slide is not visible.
Okay, just wait. Where is it visible now? Sir?
No, ma'am, not visible. Yes, just this coming. Yes.
Yes, okay. Shall I continue, sir?
Yeah, yes, madam. Madam, continue, madam. Background voice.
Okay.
Yep.
So school age children or schooler, when you say the ages between 6 to 12 years of age, it has variety of labels, that is school age, school years, as well as middle childhood. Even the middle childhood, we will be discussing the later part of 10 to 12 years as a pre-adolescent or pubescent stage. So I'm having problem in sharing the slide. Just a second, sir.
Okay, ma'am. Okay.
So next we move on to physical growth and development. Biological growth. So when we speak about biological growth, we are talking about the physiological parameters as well as the body proportions. Normally during the school age year, the growth is slow and steady. That's why it is called as growth during the school years is characterized as gradual in almost all body parts. Coordination and muscle control increase as grass and fine motor are perfected. So here physically the girl children as well as boy children are increasing their body proportions. They will be taller as well as the girls will be weighing little more compared to the boys. Next, regarding weight and height. So as I said, there will be difference between boys as well as girls. So there are sex-related differences commonly seen among school-age children. Boys gain slightly more weight, but whereas height gains similar, but boys tend to be taller. Next, we move on to the formula. Hope you all may be familiar with this formula. WEECH formula for calculating weight. 1 to 6 years, because 6 year onwards we are dealing. That's why the expected weight in kilograms equal to age in years into 2 plus 8. This is for calculating the expected weight of children of 6 year age. Then the weight calculation is done for 7 to 12 years with this expected weight in kilograms equal to age in years into 7 minus 5 by 2. So these are the formula which is used to calculate the expected weight of school-going children. So for the height, it is very same. The age in years into 6 plus 77 centimeter. So when you are doing the assessment of growth and development, you will be monitoring the weight with the weighing scale as well as the height also with stadiometer. By this, you can compare. By applying this formula, you may compare the actual weight gain of the children according to the age, both in boys as well as girls. Next, move on to mid-arm circumference. Mid-upper arm circumference, hope you will be measuring. This is very commonly done among children between 1 to 5 years of age in order to do the nutritional assessment. Okay, based on that only, we will be grading the nutritional status. Even it is continued to be monitored in the school-age children also. But at 12 years of age, it is about 17 to 18 centimeter. When the child reaches to 15 years, it is 20 to 21 centimeter. So this slide gives you the difference of weight among children between 6 to 8 years. That is 17.5 to 22.5 kilograms. They gain 3 kilogram per annually. The same as in height for 6 to 8 years of age children measures 110 to 121 centimeter, where they are gaining 1.13 centimeter every 3 months. Then 8 to 10 years, 22 to 30 kilograms. The average weight gain is 3.8 kilogram yearly, whereas the height measures 121.5 centimeter to 136.5 centimeter, where they gain 1.113 centimeter average per year. When regarding 11-year-old child is weighing between 22.5 to 39.5 kilograms, where approximately 3.8 kilogram of weight gain annually. The same as in height, it is 131.5 to 147.5 centimeter. Whereas in case of 12 years, so by the age of 12 years, there is a varying of weight and height measures among boys and girls because of the initiation of pubertal growth. That's why boys are weighing 30 to 48 kg, whereas girls 30 to 50 kg. In case of height measurement, boys tend to be taller. Even then, the girls also the girls also becoming taller. Okay, that is 142 to 158 centimeter among boys. In girls, it is 144 to 160 centimeter. Next, we move on to the physiological development. So, physiological development consisting of our organ systems. So, most of the body organ systems are fully developed at the age of school years. Till there are little changes that happens in specific systems that we are going to see. So, when we are talking about cardiovascular system, so cardiovascular system during the school age year, when compared to the other parts of body, heart grows slower. That's why during this period only, heart assumes a more vertical position in the chest because of left ventricular development and downward placement of the diaphragm. And also, heart murmurs peak during 6 to 9 years of age. So this is called as innocent murmurs. Why these innocent murmurs are happening is, this is due to the placement of the heart relation to the thorax. Okay, there is a changing size of the heart in relation to the thorax that causes innocent heart murmurs. And also in cardiovascular system, the first physiological splitting of heart sounds may be heard. This is due to why this physiological splitting of heart sound that is first time heard is, here the pulmonic valve tend to closed slightly delayed than the aortic valve, especially during the inspiration. So that is very commonly here during this age group. Okay. So next we move on to the vital signs. So vital signs, pulse and respirations seems to be no much difference, whereas blood pressure level will be increasing comparative to the preschooler age to schooler age. So the pulse rate among 6 to 8 years of age children, 90 plus or minus 15 beats per minute. The same in case of 8 to 10 years of children, 85 plus or minus 10 beats per minute. The same for 10-year age child, 90 plus or minus 20 beats per minute. Then comes to 12 years of age, boy children, they have 90 plus or minus 20 beats per minute, whereas girls, it is only 85 plus or minus 20 beats per minute. This is regarding pulse rate. Then we move on to the respiration. Again, 21 plus or minus 3 breaths per minute. 8 to 10-year child has 20 plus or minus 3 breaths per minute. In 10-year, again 19 plus or minus 3 breaths per minute. It's same as for 12-year child also. Then we see about the blood pressure. The blood pressure is 100/60 millimeters of Hg plus or minus 16/10 millimeters of Hg. The same thing in case of 8 to 10 years of old child, 102/60 plus or minus 6/10 millimeters of mercury. Then 109/58 plus or minus 16/10 in case of 10-year-old child, whereas in 12-year-old child, that is 113/59 plus or minus 80/10 millimeters of mercury. This is regarding the vital signs of children from 6 to 12 years. Next, we talk about immune system. So, immune system also continues to develop response to infection, is specific and localized. During the school age, the child body is able to produce antigen antibody complex, and also the specifically IgG and IgM immunoglobulins are reaching the adult levels. That's why the antigen antibody complexion is taking place during the school age period. Regarding motor system, this is talking about the locomotion. So specifically here the school child continues to refine previously acquired skill. This we can talk in terms of gross motor and fine motor skills in the later slides. And also the child needs regular exercise, approximately 4.5 to 6 hours daily to develop normally. Why it is said is when the children are allowed to play in an open place. Okay, so they are enjoying their activities and the coordination of the muscle as well as the activities are being improved. So here when you see the motor system, already we discussed that boys are seen very tall. Boys appears to be taller, whereas girls also continuing to grow in their physical appearance. They enjoy playing. Okay, so the play enjoyment helps them to improve their muscle coordination. Next, regarding nervous system. So by the 10 years of age, the brain development is completed. By the 10 years of age, the brain development is completed, which is essentially mature. So this can be seen about their cognitive process. So their thinking process, thinking and reasoning skills are evident, and also they are very aware of about their senses. Okay, the sensory development also being measured by the age of 10 years. Okay. Next, we move on to the sensory development. So by the time the child reaches the age of 6 years, central visual acuity is established. So here the child is able to see the objects very clearly, and also they attain their visual acuity as of adult, that is 20/20 at the age of 7 years. Okay, so by from 8 year of age to adolescent, the tendency to myopia increases in case of children. So normally the child used to complain in the very primary classes. So primary classes, the first complaint of the child may be they are not able to see what is written on the blackboard. I am not able to see it clearly. Okay, I am feeling very difficult by sitting. So they tend to stand up in front of their bench and try to write and all. So that is the initial sign where the child need a visit to a eye doctor or eye specialist. So that is the commonest age where you can find myopia among children. Next, their sense of taste as well as smell mature because they used to have different kind of foods. Okay, once they enter in the school, they start to share their food. Okay, that is very common. Even nowadays in the school, there will be a days are conducted in that sharing day. So for the sharing day, the children tend to taste different kind of food stuff and they are fond of it. And the same like the smell also mature in case of school going children. And regarding the touch, able to locate application of heat, cold or a pinprick to body surface. They are very aware of this application of heat, cold as well as a pinprick. This is all about the senses. So next we are moving to sleep pattern of school children. So younger school age normally 10 to 12 hours per day. So this 10 to 12 hours per day includes an evening nap also, because once the child is coming from school in the early classes, that is primary classes, they feel so tired. So about 1 to 2 hours they tend to sleep in the evening. So altogether 10 to 12 hours per day, whereas in case of older school age, they used to sleep for 8 to 10 hours per day. During the school age time, the nighttime terrors may continue because they are showing interest in watching horror films or cartoons, or even they used to hear bed stories. Okay, reading bedtime stories, or sometimes they may ask to tell a story from the mother or a caregiver. So when they are hearing or listening or seeing those kind of activities may increase their terrors during the night time. Next, regarding dentition, you know that, sorry. So, normally the deciduous teeth are replaced by the permanent teeth. So, tooth losses commonly start at the age between 6 to 7 years. Mostly it is observed during the 7 years of age. So, this pictures give you that is first fall of teeth starts from the age of 7. Okay, next lateral incisor at the age of 10. Then canine at the age of 11. First molaris at the age of 10 years. And the same like central incisor in the lower teeth is 6 years of age. Lateral incisor 7. Canine 9.5. That is almost about the completion of 10 months. The same first molar and 11 molar. So all the teeth starts to lose one by one. By the age of 12 years, the child is about to have 28 permanent teeth by the age of 12 years. This is regarding dentition of children. Next, we move on to the motor development. First, we will discuss the gross motor development of children between 6 to 8 years of age. Okay, so here during preschoolers, you could have watched children were running the riding the bicycle with support wheels. Okay, that is training wheel at the back of the wheel they'll be having, and also sometimes they need assistance. But during school age child, they try to ride bicycles without training wheel, and they are able to run, jumps, climb, hops constantly in motion. We never make them to sit in a one place. If they are allowed to play, they go run here and there, they climb over the grills or the upstairs. Okay, they try to do backward stepping of upstairs. Okay, all those things are possible during the age of 6 to 8 years. Then they used to do clumsy and awkward movement. If we are not encouraging them also, we may be fear what they are going to do. So the main example for this clumsy and awkward movement, we can say they'll be blowing bubble with their saliva. Okay, if we ask them also, they may not stop. They'll be repeatedly continuing. So instead of throwing ball up and down, they'll be throwing here and there without noticing that it may hit them or not. And as I said, the muscle coordination also improves. Apart from that, eye to hand coordination also improves during the 6 to 8 year old child. Then between 8 to 10 years, child starts to perform tricks on bicycles and races. This you could have experienced when you were school children. Okay, because always when you take a bicycle, you call your friend nearby you to enjoy a trip. So once the friends are forming a gang, you will be conducting races. Who will be reaching the particular place first? Or sometimes some children tend to leave their both hands and try to pedaling alone. So that is the performance of tricks on bicycles and races. And also they begins to participate in organized sports. Okay, group sports activity, which improves their muscle coordination very well. And also they throws balls skillfully overhead, and also they are able to understand what is being played. Okay, this is regarding gross motor development among 8 to 10-year-old child. Next, about 10 to 12-year-old child enjoys all kind of activities, not only playing, jumping, running, climbing, even they form a group. Within the group, they try to enjoy maximum by using their physical ability. Okay, this is regarding 10 to 12-year-old child. Next, we move on to fine motor. Okay, the fine motor, you know that how the child is able to improve their ability by using their fingers. Okay, so that is in case of 6 to 8 years, they know what difference between right from left. They are able to say which is right, which is left, and able to brush themselves and try to comb by themselves. Learn cursive writing. Even they draw, paint, they are able to use painting with different color materials. Their eye-hand coordination is improved very much. Okay, so they are interested to draw or scribble something. They'll try eagerly do their paintings. Then bath self-unassisted. So from 8 to 10 year onwards, they never allow mother or caregiver to enter into the bathroom. They said they are able to manage themselves. Even if the things are given to them, they say that no, I am able to collect what is needed for me. So please leave me alone. I am able to take bath myself. Okay, and also they are very curious to do that also. Next, fine motor development among 8 to 10 years old children. They use both hands independently so that they are able to dress themselves. Okay, cursive writing is well improved, dresses self completely and able to draw a person with 18 to 20 parts. This is about 8 to 10 year children. Whereas in 10 to 12 year children, they are little more advanced. Their coordination continues to improve. Dressing and grooming skills well developed. They are able to take care of their personal hygiene. Next, we move to the self-care of school-age children. First, we will discuss about 6 to 8 years. So the feeding skills. Okay, at the age of 6 years, the children like to eat with finger. Okay, they try to eat by themselves. And whenever if the mother or caregiver is feeding the child, or even the child themselves are taking a feed, they used to keep their food inside the cheek. Okay, always they take long time to swallow. By having the food in their mouth, they'll be keep on talkative while eating. So they are not much concentrated on eating rather than they are talkative. But in case of 7 years, the improved table manners, they know how to handle the food items, where to keep the utensils like that. Okay, and that they'll be reducing their talking habit and they prefer bolt food. This is nothing but the packed food items. Okay, you can see the packed, they grasp the attention of the school age children between 6 to 8 years very much. Okay, nowadays all the children are watching television, not only television, they are downloading most of the videos from the YouTube. So by seeing that, they are about to name those packed food items and also interested to have those food items. Okay, that is called bolt food. And coming to grooming and dressing skills, self-care is managed and they has a tendency to dawdle in bathtub. They play more when they are taking bath. Okay, and needs to be reminded to wash hands. That is, even if they go out for play, after coming back from their play activity, directly they'll get into the kitchen and they used to take something else. So once they are entering into the house, the mother or the person in the family will be reminding them, please go wash your hands and come, then you can have your snack like that. Okay, so then may need some help with dressing. 6 to 8 years, already we discussed that they started, but they need some helping. Then they are able to wear the clothes which is chosen by parents. Okay, whatever the parents is helping them to dress, they accept. But when they are removing the cloths, they will be keeping those cloth where it is. Okay, the same thing they will be keeping there itself and go off. And coming to 8 to 10 years, feeding skills. Here, the children are able to handle eating utensils skillfully. They know where to take, and after finishing their eating, where it has to be replaced. Okay, before that and all, they used to throw on the dining place itself, but from 8 to 10 year onwards, with the guidance, they used to keep where it has to be washed. Then in case of grooming and dressing skills also, they dress self completely and enjoy selecting own clothes. So about 6 to 8 years, they wear whatever the parents give. But once they are moving to 8 year onwards, they try to select their own clothes, even not only for wearing, when buying also, they shows their interest and colors choosing will be very improvement is shown in dressing. Then unaware of dirty clothes, even if they are wearing a dirty cloth, if somebody is telling that your cloth is very dirty, please change the cloth, but they never bother, their concentration will be on their activities only. And always there need to be reminded to brush teeth. This obviously happen in our homes too, because if you are not reminding them to brush their teeth, because during this period only they are trying to bath themselves. Okay, so when they are getting into bathrooms, they forget to brush, they enjoy with their bath. Okay, that's why they have to remind them for brushing their teeth. Next, 10 to 12 year age child self-care, you know that they are well developed. Criticizes stable manners of parents. So before this age, normally the child will be receiving the guidance as well as correction from the parents, how to sit on a dining hall and how to keep hands, so like that. But now they are mature to correct or criticize the action of their parents. And grooming and dressing skills, they may wear some clothes continuously. So this is like they used to say that when I am wearing this color t-shirt or this dress, I got a new pair of shoes. I got a new dress. When I wear this dress, I got a reward or a gift from my parents. So this is very close to me. So even the mom asked them, please, every day are wearing the same, change. Why can't you change your clothes like that? But they will be having this as a very closest to them. So that is very common during this age group. And here also they continue, leave clothes where they fall, and enjoys wearing current styles of clothes. This is nowadays you can see among school children. Once a friend of his wear a current style of cloth, immediately they have the intention to buy and they have to groom themselves with current style of clothes, which is very, very common in school children. And they need constant reminding of personal hygiene. Until 10 years of age, the child must be reminded, please take bath, it is time for bathing. Did you brush your teeth? Where do you keep your dresses? So like that, constant reminding of personal hygiene is needed. But whereas in case of 12 years old, the children tend to bath frequently, at least twice a day, because here their grooming skills are little more improved, and this is due to the influence of initiation of pubertal stage 2. Okay, so this is regarding the self-care skills for school-going children. Next, we move on to psychosocial or emotional development by Erikson. So according to Erikson, he states this school age period is the child has a sense of industry. So the personal interest as well as self-esteem. Okay, these both are the central attention for the children to develop their attitudes. Why it is said sense of industry? Because the children try to show their new ideas as well as whatever they learn or explore in the environment. It need to be accepted. So the first acceptance is from the peer group, then from the teacher, and from the members out of the family. Okay, so that improves the sense of industry. So the main goal is to achieve a sense of competence. So whenever the child is mastering a new skill, when he is showing his ability or doing a particular performance, for that particular performance, if he is given reward or if he gets appreciation. So the appreciation is not only from the family members, outside the family, they must be accepted by the teachers by grading, by peers when they are accepting his performance, and also when he is enthusiastically encouraged to follow the particular mastering of new skills, automatically child promote his sense of industry. So it is vice versa. When the sense of inferiority lies in the children, or when the child is unable to perform mastering of a new skill, so he has the feeling, I am not worthful up to my level. Okay, whenever the child is discouraged or the child is not receiving good grades from the teacher in the school performance, not only in the school performance, academic performance as well as co-curricular activities, if the child is not supported adequately, even if he failed to mastering his new skills, okay, so automatically the child will have the sense of inferiority. So emotionally, when the child is supported or encouraged, their self-esteem is being promoted. So this is not only done by a single person in the family or outside the family, wherever he goes, because this is the period where the child is exploring his activities and his new ideas, okay, outside of the family. So it may be a school, or it may be a social group, or it may be among his friend circle. Okay, so the encouragement is from not only from the family members, it is from the outside people also. When the child is recognized and appreciated with the rewards, he is developing sense of industry that promotes self-esteem. Whereas if the child is not supported adequately, the child feels himself as worthless, and the depression falls over the child, which may lead to sense of inferiority, which is at risk, where those children must need full attention of the parent as well as the teacher. Okay, this is regarding psychosocial development. So when you are assessing the growth and development, you are mostly asking the children, how do you feel, or how do you feel yourself? Sometimes the child says that, yes, I am able to do whatever you say, I am ready to do that. So they'll be showing that know-it-all attitude. Whatever you say, they will be coming to you and they are helping you to achieve your assessment. Okay, some children are like that. When you ask some questions, they will not look at their parents. Okay, openly they talk to you because they think you are doing good thing for them. So they, by seeing your way of approach, by that the child is able to improve his esteem to answer you. But whereas some children, those has the sense of inferiority, how many times if you approach the child, even with the presence of parents also, they never like to open up with you. So that shows how much the child attains sense of industry and sense of inferiority. Next comes psychosexual development. This was described by Sigmund Freud. So according to Sigmund Freud, school-age children moves into latency period. So this latency period, they are aware about their sexual role. That is, as a boy, what how I should be. As a girl, how I should be. Follow certain things. Okay, so here normally the same-sex peers are attracted. Girls tend to play with girls. Boys tend to play with boys. Normally they avoid opposite sex. And also girls may be fear of boys of same age, because normally when the boys together, they used to be more talkative and even they make fun of them. Okay, that's why they may fear, because of the physical appearance and also the nature. In nature itself, the girls may be fearing of same age of boys, though they will be draw apart from them. And girl associate girls in their play, boys with boys. That also we discussed. So when you are asked to tell the name of friend who you are playing. So boy children used to give the name of boys, whereas the girls used to give the name of their classmates with girls. Okay, this is regarding psychosexual development. So during this period, the boy as well as girl is aware about their own sex, and they are able to know what they have to be followed. During this psychosexual developmental stage, Sigmund Freud tells that the parent or the primary caregiver, especially mother, should talk about the sexual role of girl even she is not asking for that. So she must introduce. This is the apt age, that is especially the age between 8 to 10 years. Gradually we should start about what is called the role of sexual role of a girl, as well as the appearance and what are all the bodily changes that tend to be developed. Okay, more we are expecting the pubertal changes happens from 10 years onwards. Even nowadays it is starting from 8 years because of the influence of modified lifestyle, eating habits, as well as influence of the mass media. Okay, so we have to slowly open the topic and we should guide them. Okay, and the same thing for boy children. The father should have a friendly approach, and they tend to expect what all the changes are going to happen for them physically. Okay, that is regarding psychosexual development. Then moving to the cognitive development, you know that Piaget described 3 stages. So among this, mostly 7 to 11 years are fallen concrete operation. So in the pre-operational stage also, the children between 2 to 6 years. So when the 6-year-old child in the cognitive development, they shows the attitude of know it all. They are being first in everything. So they may say that I am ready to do that. Okay, so if you ask questions to somebody nearby them, they will show that yes, I know, I am able to answer. When a question is posed, immediately they come out of themselves and they are tend to answer. That is, you can see in the pre-operational stage, where during the pre-operational stage, attention span is increasing, and also the student is able to tell the alphabet and able to tell time also. This is the commonly seen cognitive development among 6-year-old child in pre-operational stage. Whereas in concrete operational, it comes between 7 to 11-year-old child. So here they progress from what they see, that is perceptual thinking, to what they reason, conceptual thinking. So here in concrete operational stage, there is a correlation between emotion, thought, and behavior. Emotion is what we feel, thought is what we think, and behavior is what we do. So there is a correlation between these 3 areas in the cognitive development. So automatically here the memory span of child increases. They will be maintaining the punctuality. Okay, and also they are decrease in egocentricity. In preschool, they will think of their self alone, but during this age group, that is between 7 to 11 years, there is decrease in egocentricity. Instead of self, they used to think about others in the surrounding, and also they are able to follow reversibility. So this reversibility is nothing but when you ask to tell them, this is mostly applicable in arithmetic calculations and conservation of matter. If when you say about a particular thing, they are able to describe what is it, how come it existing. So this is somewhat improved, where they will be improving their understanding of relationship between things as well as ideas. Okay, that is regarding concrete operational stage. Then they are able to classify the objects. Classifying the objects in the sense they are able to found which is taller one, which is shorter, which is smaller, which is bigger. And also they have the habit of collecting stamps, collecting pictures or collection of different coins. Okay, this habit formation is developed during the concrete operational stage. When about 12 years of age, that is formal operational thought. So here the child is able to define abstract terms. Okay, during the 12 years of age, the child is able to define abstract terms as well as their uses problem solving skills. Okay, when you say a situation, or if you are telling about a particular phenomena, okay, they are able to explain what is it, how it is existing in nature. Okay, that is, they are able to find the meaning of abstract terms. This is regarding cognitive development. Okay, among school going children, we have all the three stages, that is pre-operational in 6-year-old child, whereas 7 to 11 years concrete operational. So in 6-year-old child, attention span increases, 7 to 11 year memory span increases. During this period, the child used to have ashamed of failures also. If they are failed to achieve in academic, they feel ashamed. And in case of 12 years onwards, they are able to define abstract terms and problem solving methods. So next we are moving to moral development. So moral development also, again, we are dividing as younger children and older school age children. So in the moral development, the children found conscience. They know what is right, what is wrong. Okay, so based on that, they think when they are doing right things, they get rewards. When they do wrong things, they get punishment. Okay, and they used to correlate the moral development as well as spiritual development grows parallelly. So whatever if they do wrong, so they will be receiving a punishment. Okay, that is commonly seen among 6 to 7-year-old child. But in case of older school age children, that is more than 9 years, rules of conduct are seen more as mutual agreements based upon cooperation and mutual respect for others. So here they are strictly follow the rules. Okay, if anybody is not following the rules, they will correct them. They are trying to correct, why you are doing like this. This is the way of, this is not the way of doing this. Okay, so you have to follow perfectly. So mostly they are very punctual, highly punctual, and whatever rules are set by them, they used to abide the rules among older age children. And the same thing, they provide respect for others. They feel for others. Okay, how I have to be respect. The same thing they tend to give for others also. When somebody is treated, so they think themselves also to be treated like same when they are following the rules of conduct. This is regarding moral development. So when you punish a child for right doing unknowingly, immediately they raise questions. No, I did not do it. It is not my mistake. Then without clarification, why did you punish me? So like that, they used to think and reveal their morality. Next comes spiritual development. Spiritual development is by Fowler, that is mythical literal faith. So here, as already said, the children are very eager to ask questions about their God. Okay, so the questions about their God, in the sense they see God as a human being. They have the thinking God is also a human being who is having a supernatural power, and they used to learn about the idols of God, and they used to ask questions why the God is like that. Okay, so there are a lot of questions they will be arising, and also they follow the ritual. When the parents are saying, when you do this, God will usually help you. So automatically, before performing a task, the child used to pray. Once after completion of the task, if the child get a reward or appreciation, immediately he used to thank the God for his help. Okay, that is there during this age group, they will be having the knowledge. And also normally school age children tend to arise questions regarding the religion, especially in the primary schools. When the child is about third grade or fourth grade, the child used to ask by saying the name. Okay, for example, Raju. He used to ask his mother, the name Raju belongs to Hindu or Muslim. So this is an example how they are able to differentiate the religion, because during this age group they are explored to the religion related festivals are taught for the children. So from that they start to ask questions. So if I am going to a temple, I am praying to the God. If a person who is a Muslim will go to the mosque, what he will be doing there? Even they used to talk along with their friends, but they need to clarify with the elders in their family. And they believe others. Normally when they say, they used to believe others and differentiate their thinking. Okay, this is regarding spiritual development. So when you are assessing the growth and development, spirituality, if you ask the child to who's your favorite God, or to what do you ask from the God, the child is able to tell what the child actually likes. Okay, from that you can assess how much the child is able to follow the rituals and other things in spiritual development. So next we are moving to play needs. So school children. Okay, school children means they are tend to play. Their main role is playing, but here they will be forming a group. So improve their group norms. Okay, they will play and provide importance to group goals. So it is called as cooperative play or team play. The characteristics of school age children play is either cooperative or team play. So here the children will be engage them in sports, debate teams. They'll be forming 2 teams and they will do debates, even spelling bee. Even they used to play Andakshari. Okay, so like that, all the play will be having a group norms. They strictly follow the group norms and they used to maintain the cooperation of group. So when they are engaging their play activities, they're dividing the task and each person will be taking in charge of particular task, and they wanted to maintain the uniformity, and they used to have nature of competition also. This provides stimulation of cognitive growth. So the group play gives more space for the children to learn the cultural beliefs as well as morality. Okay, what they have learned from the family, now they are going to exhibit out of the family. So the stimulation of cognitive growth is possible, and they are able to play complex board games, computer games, and reading for pleasure. This you all may be aware. Nowadays there are a lot of games children used to play. I think Temple Run and the PES 2020 football matches, cricket matches, everything is available now online. But only thing is they must be watched by the parent when they are using this gadgets for their play. That is very, very ridiculous. If it is unwatched, it may lead to some unwanted experiences for the children. That's why the parent must be given advice whenever the child are handling the gadgets. They must have a watch on them. Okay, that is very, very importantly specified to the parents when we are talking about play needs, how to take care of play need of the school going children. And normally the falls as well as problems with the fracture and all very common when the children are playing heavy activities. Okay, this is regarding play needs. Next, moving to language development. So school children is about to speak 20,000 to 30,000 words at this age. They are good in pragmatics. This is nothing but they have the linguistic development. They are able to use different vocabularies in different situations. They are able to use with trial in learning nature, and they are able to explain information to a listener to effectively communicate what does listener know and not know. So by exploring their language, they are able to convey the message they wanted to convey to whom they are telling. Okay, and they are able to initiate and maintain a conversation. And when you are giving an idea, they are able to grasping a main idea without getting lost in detail. Wherever if you break them, they are able to come up with the main ideas, and also they are good enough to make inferences. So when somebody is talking, they used to grasp things which are good, which is not accepted by others, and why it has to be done like that. Okay, so this is, and during the language development, the common problem the school age children faces are some children will be having difficulty in vocabulary. Okay, some children are able to have difficulty in vocabulary, and also during the school age, because of the tooth fall, there is a change of some words or letters. That is also possible, but the children may feel shy in front of others to speak, but that time the child must be encouraged to speak whatever he want to express. That is more important during the language development. For assessing the language development, if you ask a child to describe about a bird or describe about a country, like that, the child is continuously start with telling about the particular topic. Okay, apart from that, you can even ask regarding the academic performance also, which subjects they like more. Okay, the same thing also you can assess during the language development. Next, regarding self-concept or body image. Self-concept or body image, already I told, self-esteem and personal interest are the central attraction of school age children. So the self-esteem is often based upon grades, teacher components, peer approval, etc. So during the old age children, peer approval is playing a major role in improving their self-esteem. Okay, if they are neglected by the peers, automatically they will feel very bad, and they become withdrawn more and more. And also the rewards from the school, okay, the rewards, gift, so all those things are promoting the self-esteem, whereas small success and small successes increase child self-image. So whenever the appreciation is coming from outside the family, the children feel themselves competent enough to go ahead with their new mastering of skills. Then sexuality, self-concept and body images tend to be changed once the children are reaching 10 to 12 years of age, because they are entering into the initiation of pubertal stage. So this is ideal time for formal sex education for the students, which describe about their bodily changes. Okay, so whenever the child is given adequate support and encouragement, the child keep up a high sense of self-esteem. Next, we move on to the needs of school age. So there are some needs, that is nutritional needs, dental hygiene, exercise, sex education, accident prevention, love and security, immunization, and parental guidance. First, we will see about nutritional needs. Nutritional needs of water, that is 7 to 9 years, 75 ml per kg. For age 10 to 12, 50 ml per kg. For calories, 80 kilogram calorie per kilogram body weight per day. For children 10 to 12 years, 70 kilocalories per kilogram per day. Whereas carbohydrates are 45 to 65 grams per kilogram. In case of age 10 to 12, 45 to 65 grams per kg. So protein 1.4 gram per kg per day, that is 41 grams per day in case of children between age 7 to 9, whereas children between 10 to 12 years need 54 grams per day. The fat remains same for both children from 7 to 12 years, that is 25 to 35 grams per day. Okay, next we move on to health promotion and maintenance, which talks about all other needs. Okay, so first one, routine checkup. So annual physical examination. So this is done in schools. Okay, annual physical examination is carried out in the school premises where the school health nurse will be doing this. And regarding immunization, during the school age, DPT booster dose and tetanus toxoid is about to be due in immunization during the school age children. Then regarding dentition, there is chance for development of dental caries. So visit to the dentist at least twice a year is advised. And moreover, when the child is having loose tooth that is not grown up to the period of age, then for that purpose also the child may be taken to the dentist. Then 10 to 11 years, first exam for scoliosis. So this is in order to, scoliosis is to rule out early problem with the spine, that is especially lateral curvature. But as a research, on research base, it is not that much focused. Even then, early period, it was done during the school ages before entering into the fifth grade. They have to undergo first exam for scoliosis. Next, vision and hearing screening before entrance to school or on a periodic basis, annual and biannual, if the child is having any difficulty in their vision or problem in hearing. This is also carried out along with the annual physical examination. Okay, so these are all the routine checkup in order to promote the health of the children. Next, regarding family teaching about dental hygiene, especially the dental hygiene is focused on child over 6 years of age. So the mother or primary caregiver is advised to follow the brushing habit of the child. Always the child is need to be reminded for brushing. Sometimes they have to be accompanied whether the child is properly doing the brushing. And exercise and sufficient rest is important. Already we discussed the sleep need for the children. So that is what, so whenever the child is having adequate sleep, their cognitive development also improves. Then health education is focused on basic hygiene and also sexual functioning, substance abuse, accident prevention. Okay, so this we will discuss in the upcoming slides. So sex education, as already I said, when the child reaches about 10 years of age, it is time for formal education, time for introducing sex education for the children, but which remains controversial because most of the school syllabus and the older children, they have a topic on their reproductive organs. Okay, but we are not sure how far this is followed in the school syllabus, but it must include helping the children to develop positive attitude about their own bodies, their own sex, their own sexual role to achieve optimum satisfaction in being a boy or a girl. So the sex education is not only given by the teachers in the school premises, even before that, the parent must start from the home itself. Once they know their children are growing, once they are reaching that adult period, reaching towards the adolescent period, the mother is able to explain what is called menarche and menses. Even if nowadays, but the children are very curious, from the friend circle, they are learning more and more with the influence of mass media. Even then, before in hand, the parent, both mother as well as father, in case of girl children, mother is responsible, whereas in case of boys, the father is responsible to explain about appropriate role of their own. That is very, very expected regarding sex education. So next, substance abuse education. So substance abuse education also nowadays obviously common among school age children, because the most of the areas the target are the school going children. Okay, so it is really pathetic when you read those articles from the magazines. It is very difficult to digest. Okay, so this Just Say No programs, it was established in US in 1980s to 1990s. Okay, so this is in order to avoid the legal trafficking of drugs by school children. Okay, so they must be given prior information about the ill effects of certain drugs with unknowingly administered to them. So they must be out of the drugs. Okay, that is called Just Say No programs, and that teach unhealthy aspects of tobacco, alcohol, and drug use. So awareness should be created among the school children, especially between 10 to 12 years of age. What are the unhealthy aspects of tobacco, alcohol, and drug use? It can be shows as a films or the campaigns. We can conduct a role play like that. You can teach them. And children may experiment with inhalants unknowingly, which may contain deliriums. Okay, because they are not aware what may happen if they consume a particular drug, because normally they have the peer involvement which encourage them to have those type of delirium drugs, which may even lead to cause of death also. So this substance abuse education must be given to children, not only limited to children, it must be given to the parents also. So in case of substance abuse education, family caregivers are encouraged to teach families values to the children and teach difference between right and wrong, and set and enforce rules of acceptable behavior, learn facts about drugs and alcohol, actively listen to the children in the family. So the last one is not existing in most of the families because of today's lifestyle, because both parents are working partners, no elders are there in the home to take care of the children. So when the children is trying to express his feeling, the parent must actively listen. That's why the parents are advised to spare at least an hour to hear to their children. When they hear patiently to their children, most of the problems will be solved. Okay, so this is regarding substance abuse education. Next, we are moving to accident prevention. So you know that accidents remains a leading cause of death. Already I said school children are very curious to explore their ideas in open spaces. Okay, so now they are, we already discussed, used to do tricks in bicycles, okay, which may lead to accident fall. Even some children nowadays, we can see in the roads, the school children are riding two-wheelers without license. Okay, so that is, which is not encourageable activity. But most of the sceneries we have that the children are driving, the parent are sitting at the back, which is not at all encourageable one. So first, the parents must receive an education when a child is able to drive. That is, after completion of 18 years, they must hold a license in order to ride a two-wheeler. Okay, that is one thing. And the children must learn safety rules and practice them. So in case of accident prevention, one more thing we have to stress is they should know the road signals, how to follow the road signals, how to use pedestrian cross for crossing the roads. Okay, this must be taught for the children. They should know the various symbols of the road safety. That is also very, very important. And the child must be taught to tell their full name, caregiver name, home address, telephone number, and how to call child helpline. Because nowadays the child assaults are very common, that is CAN, child abuse and neglect, and also child labor is also an increasing problem of our society. So when any child is under trouble, even the children are given training to know about the use of child helpline number, even they can save the pair of his own. That's what it is stressed. They should know what is the child helpline number and what is the role of it. When they call, what kind of help they will be receiving. Okay, so this is regarding accident prevention. Next, safety topics, which already some of them we discussed, traffic signals and safe pedestrian practices that has to be taught for them. Then safety belt use for car passengers when the school children are about to have a car drive along with their family member. They must be known about the use of belt because they insist the use of safety belt for their parents, and bicycle safety while riding, skateboard and skating safety, swimming safety where they have to wear the jackets without supervision of others. They never allowed to swim. Then use of danger and projectile toys, danger of all terrain vehicles, how it may danger their life, and use of life jacket when boating. So all these topics should have health education for the school going children, how to improve their safety needs. So next we move on to school age child's concept of illness. Sir, I'm running out of time. Should I? Hello?
Yeah, ma'am, you can continue, ma'am, and 10
Continue.
more minutes. Yes.
Okay, thank you, sir. So next we move on to school age child's concept of illness. So here, school age children perceive illness as having an external cause. Okay, so how they feel it as an external cause once they become ill. Okay, they'll be having some symptoms. So whatever symptoms they feel, I was doing right things only. Yesterday, I did not do anything wrong. What might be wrong with my body? So like that kind of thinking they may be having. So they may view pain and illness as a punishment for wrongdoing. And preschoolers may not have that much fear, but they tend to know about things. Whereas in case of school age children, they are able to express their fear related to bodily harm, pain, as well as death. So during this school age children, their concept is whenever they become sick, they think they have done something wrong. That's why they got the illness. That is the opinion about concept of illness among school age children. So their reaction to hospitalization, normally there will be having lot of fear. So loss of control and abandonment. So which they may fear about something is going to be lost, and they feel about injury, fear about injury and death. So whenever the procedures are done for them, before preparing for the procedure itself, they'll be having fear and anxiety related to pain as well as outcome. Okay, that is very, very common among school-going children. Next, pre-admission preparation. In case if the child need to undergo any invasive procedure, it may be minor or even major surgeries, it is ideal age for advanced preparation because most of the problems may be a planned one. Okay, so in that cases, the tour is nothing but whole time of the tour will be 1 hour. if the child is about to undergo an appendicectomy. So the child will be taken to the OT where all the equipments are there, what all the things will be done when the child undergoes surgery. So a pediatric surgical nurse will accompany the child and she will give orientation about the surgical procedure. That is called as tour. And even classes is with any clippings or videos she can demonstrate. Then we can provide booklets about the surgery. What is the surgery, why it is being done, what will be the outcome, so what are the instruments. So like that the child will have a look on it, and after that the child will be discussed with honest answer. Once they are explored to the situation, they may have lots of questions and doubts that must be clarified with honest answer. Thereby we can prepare the child very well. Next, the interventions to promote coping. How you can promote coping when the child is hospitalized. Okay, so encourage questions and discussion. So some children may have lot of queries in them, but they may hesitate to ask. But you must encourage and make them to clear about their doubts by use of diagrams, models, and equipments, and additional explanation. And you can encourage participation in care of children. And also you can allow the parent involvement and the stay, which may promote the coping in case of hospitalization. Then you can use books, games, role play to work through feelings and to prepare child for procedures. You can allow them to ventilate their feelings by reading the books, encouraging them to play games. Okay, so whatever they want to spend their time before preparing the procedure, you can allow the child, and you can promote contact with family, even friends and school. That is advisable. So next we move on to the developmental problems. So developmental problems commonly seen among school-going children are truancy, fear of darkness, school phobia, stealing, nail biting, teeth grinding, tics, hurting others. So what does mean by truancy? Truancy is unwanted excuses are given for attending school. So for about a month, the child used to attend only 15 days. The other 15 days, the child will give lame excuses for not attending the school, since the child is not enjoying the school atmosphere, or he is having some problem along with his peers, or maybe with teachers. Okay, that has to be ruled out in order to help them to out of truancy. Then second thing, fear of darkness. This is very, very common, the nightmares. During the night hours, they have the fear if they are left alone. Then school phobia. The school phobia is again maybe due to some reasons that they are not interested in academic activities, or they continuously fail to perform in the academic activities, or sometimes they used to get poor report from the teachers. Okay, that is also maybe problem for school phobia. Next, stealing, nail biting, and teeth grinding. This all can be detailedly studied under child psychiatry, where you know that why the stealing, nail biting, and teeth grinding is commonly occur among school-going children. So you know that it is a movement disorder. Okay, unknowingly the child may be moving any one of the body part. For even the shoulders, they may be shaking their shoulders like this, or always wiping the mouth. Okay, or always they'll be smashing with the lips. So these are the some movements which causes showing their behaviorally affected. And hurting others is especially the important thing we have to discuss under hurting others is called bullying. So bullying is when the child is not encouraged by the peers, or if the child is having some problem with any one of his peer, he used to bullying others. So in her bullying also there are direct bullying and indirect bullying. Direct bullying is always a physical hazards. Okay, physical hazards is done. That means physically the boys may fight with the same peers. Okay, that is direct bullying is common in male children, whereas indirect bullying is common in girl children, that is by gossiping. That is very, very commonly seen among girl children. So these are all the development problems are addressed during the school age where the child need counseling and guidance. Next, we move on to some other special problems. So first one is stress over programming. So under this, we are going to learn about hurried child and latchkey children. So hurried child are the children, those who are tend to perform more and more beyond their expectations. Okay, so here the parents are forcing the children to do or achieve things beyond their performance or skill. That's why the child are called as hurried child. Always the parents will be showing their interest or they need their child to be first in all the things. If actually the child may not be interested in dancing, but the mother or father is compelling the child to attend the dance class, so they will be scheduling the children timing rather the child. Okay, here they are not giving the child to express his own nature of willing. So that is hurried child. Whereas latchkey children are the children those who are spending at least 2 to 3 hours per day without anybody's supervision. This is commonly seen in children both who are working partners, maybe going to the school. When they come back in the evening, the children will they'll be having the house key, they will open and they will do their works as they wish. Okay, sometimes the child may not reach the home. They may go with their friends to the park or to any public places where they will be spending their timings without elder supervision. That is called as latchkey children. They are also always problematic. And then regarding fear and worries regarding school age children are violence. So the violence starts as bullying. Next, failing, feeling stupid. So the failing, feeling stupid is in the school atmosphere when the child is not able to increase his skills or mastering the skills in academic performance. So this will affect the entire habit of the child. So the child himself feels he is not worthy for anything. Okay, so he himself has the feeling of stupid. So he stops his mastering of skills. That is also a danger zone where the child need attention. So this failing, feeling stupid is because of not being accepted by peers, changes in family structure. So there is an abrupt loss of parent, either one of a parent, either mother or father, or they are under the custody of relatives and holding too many adult responsibilities in the early school ages. Okay, so all these things makes them to feel stupid. Okay, so these are the special problems nowadays we are addressing among the school age children, which need to be taken care of. So next, certain common special problems that is regarding discipline. So in order to maintain discipline, we can use this measures, that is withholding privileges. If the child is showing constructive discipline, so if the child, in order to promote constructive discipline, we can have withholding privileges. Withholding privileges is giving rewards. Okay, if the child is about to get a new dress, if the child failed to maintain the routine discipline, that can be withheld. Once the child is achieved, it can be given. Then contracting. Contracting is we can provide giving, when you are achieving the particular discipline, the mutual contract. So if the child is offering for something, So the same like the parent may be offering, okay, if you are doing or following the disciplinary habits for about a month, you are eligible to receive a reward from myself. So that is a contracting. And even this both are not working, we should sit along with the child and we should find out why the child is not able to follow the discipline. So always when you are focusing discipline, it must be constructive, not in a destructive manner. You should never blame the child for what he is doing. Instead, we should help the child why he is not able to follow. You should find the reasons or causes and help the child to get rid of from the causes. Okay. And also when the child is having the following dishonest behavior, lying, stealing, and cheating, this also plays a major impact in following discipline. So it is also to be addressed in order to find out the difficulty why the child is doing this dishonest behavior. So these are all the special problems which we are focused on school age children. Okay. So, as briefly, school children are about self-aware, they are competent, highly punctual. Outside of family, they access their new world. They have own behavior control, especially about 12 years of age. They like challenges, they are adorable and attentive. They have group involvement and all they are elegant. So by this, I am concluding the presentation. I thank once again the management of Lute College of Nursing, Principal, Professor Senthil Kumar Sir, and faculty for the support they gave to me. Thank you, one and all.
Thank you, madam, for sharing your vast experience and knowledge with us. It was like a tour that we are traveling from Trivandrum to Kannur, but you made this session was so fantastic. And it was like I was thinking about my school age during how I was dressing, how the friends, how we used to play, all those things. And when teachers and other colleagues were, when they are like encouraging, we were more enthusiastic to do the things like more fruitful way. So it was like wonderful session, madam. And I'm sure that all of us, like those who are participating in this webinar, they were also thinking about the same, they were also feeling the same feelings. Thank you once again, madam. And the floor is yours. All participants, you can ask some of the questions. If you have some doubts or about the session, you can something if you want to say, you can tell. Madam, can you?
Yes, sir. Yes, participants, if you have anything to ask with me, you can. Anything, if you feel left out, you can ask about that also.
Madam, can you stop the screen sharing?
Okay. Okay, ma'am. Any questions?
Dear participants, if you have any queries, you can ask.
Professor Ushavi, thank you very much for your wonderful session. But when every time when the session is coming to an end, when we'll ask the participants to ask question, then everyone will mute it. But when we ask them to unmute, they can start unmute it actually. That's a
Okay,
scenario.
sir.
I know it's a great enthusiasm by every participants. But like I take this great opportunity to thank you from my desk actually for giving a wonderful session on to the schooler. I was actually speaking very eager to attend today's session and tomorrow's
Yes,
session.
sir.
Not as a professional, but as a parent actually, as a father.
Yes, sir.
I have one school age in my home and one adolescent in my home actually.
Definitely,
Basically,
sir.
but when initially I'm engaged with the year for admissions, so I could not able to continuously attend, but in between I was attending your session. I have a lot of questions in my mind because I'm
Yes, sir.
seeing an
Definitely.
in,
Definitely, sir. Possible.
in my home, which as a parent I'm observing my child. But you know, we though as a professionals,
Yes,
we are
sir.
studying growth and development during our own BSc nursing and MSc nursing period, but that is
Yes,
for
sir.
the examination purpose. But when the real life comes,
Yes.
things are getting different. I'm
Yes.
really pretty feel for all the children because we put all our thoughts onto them. We are terribly making them to a disaster for all the children. But when we go through the normal growth and development, we understand the feelings of the children actually speaking. So like I have one couple of doubts, like where you mentioned about their motor development and all.
Yes,
You
sir.
said 4 to 6 hours of exercise.
Yes,
That
sir.
means you mean to say like it is a kind of voluntary exercise, or it is a day-to-day
Not
affairs,
true.
or their
Day-to-day
play?
affairs, they tend to be given the timings, sir. Normally in the schools already they will be having some, at least 1 hour they'll be having as a PET class. Apart from that, this 4 to 6.5 hours from the morning once they wake up, most of the parent ask them to study. But that is not the kind of thing. They should explore, they should start their movement. That is body movements they has to do. Okay, that is for the muscle coordination, where they are able to step in, step out, and they will be learning. The same thing once they are coming from the school, and again we are sending the children to for tuition or some other areas. Okay, where they have to keep on their study, but it is not like that. Especially this 4 to 6.5 years may be a split at whenever they find timing, the children are about to left for their own performance. That is what the 4 to 6.5 years is meant, sir.
Thank you. Like well, that is the reason why. That's as a parent, I understand that. Like we usually like even when I compare to my boy, like as you mentioned, he has his own activities. I was just wondering, and as every children is unique, and as a parent, like we always push them for studies and sit there, don't walk there, don't play there. But that is the environment which is going on. Especially children are living in the apartments and the flats. You know, they don't have a physical playground facilities, but now children are really struggling for this moment. That is the reason why the like central government is under a CBSE. They are even changing the curriculum. The new education policy is giving more importance during this age, not into curriculum, but playway method based play activities they are encouraging. I understand this is one scenario. Next, I have one practical questions uh, like the grinding of the teeth. Is it like until what age it should be a normal grinding of teeth during sleep? Your mic is muted. Please unmute and answer, please, Usha.
So actually, teeth grinding is a very uncommon thing. When the child is having stress only, it is seen as a teeth grinding. Once or twice a while in the nighttime sleeping, teeth grinding is considered as the normal. When I am approaching an dentist, one of my cousin, he used to tell, because my son also had the same problem. He says that teeth grinding once or twice is a very common, but it extends in a per week. It is more than 10 to 12 times if a parent is noting. It needs to be the child is under a stress. That stress may be due to home environment or the school environment. Even the peers involvement also is a cause for teeth grinding. That is what, when I consulted with the dentist, I heard this teeth grinding.
Okay, how it should be addressed then actually, if it is that is the case?
So if teeth grinding is continuing as a habit, then we must talk to the children. First, we should find out the stress related factors. We should observe what is the routine activity of the child. Is any deviation from the routine activity, or he is showing anxiousness towards a particular scenario that as a parent we can notice. Once we are having the doubt, my child is afraid of this particular area, so this may be a chance for this. So we can make them to undergo a counseling with the clinical psychology, pediatric psychologist.
Okay, thank you. Thank you very much. As a parent, I asked this question. Thank you very much for your wonderful
Definitely,
session.
sir.
Thank you. And please go ahead. Ms. Surya, please go ahead. Anybody have any questions? Please ask. Thank you.
Any participants have any doubt? As we express our gratitude, we must never forget that the highest of appreciation is not utter words, but to live by them. Now I invite Mrs. Grishma Casey, HOD, OBG Department, Luth College of Nursing, to deliver the vote of thanks. Over to you, madam.
Thank you, Jasna. Saying thank you is more than good manners. It is good spirituality. Good afternoon, everyone. Respected dignitaries, dear colleagues and delegates. We have reached the end of the session. Today, I, Grishma Casey, take the opportunity to put my gratitude into words. First of all, I would like to thank Almighty God for making today's session a great success. On behalf of Luth College of Nursing, I would like to extend my heartiest thanks to our Honorable Speaker, Professor Usha V., HOD of Child Health Nursing, College of Nursing, Kannur Medical College, Ancharakandi. Thank you, Madam, for your wonderful section on growth and development of schooler. We are thankful for your time and efforts made towards making it a memorable one. Your lecture was impressive and would certainly benefit all of us. Thank you, Madam, for your inspiring and motivating lecture, which helped us to improve our knowledge about the topic. Thank you, Madam.
Welcome.
Wholeheartedly, I must thank you, our principal, Professor Senthil Kumar T., who is the backbone of our institution, for his support and guidance. Thank you, sir, for assisting and encouraging all of us. I thank Mr. Johnson LK, Vice Principal, Luth College of Nursing, for his unparalleled support to make this webinar successful. Thank you, sir. My heartfelt thanks to Mr. Sriraj RN, HOD of Child Health Nursing, heads of various departments and the faculty for their valuable contribution, guidance, and encouragement in all our effort. Now, I would like to thank all the delegates for your active participation and timely attention throughout this webinar. Thank you, one and all. Thank you.
Thank you, madam. Hope all of you had a nurturing experience. Tomorrow also we will have the continuation of the webinar series. And thanks and regards from Luth College of Nursing. Thank you all.